Lyme disease pilot study, antibiotics versus natural medicine. Who won? The answer may surprise you. The tick-borne illness Lyme disease, a bacterial infection transmitted to humans by ticks, is more than just a modern trendy disease that we see celebrities diagnosed with. For some, stage 3 or neurological Lyme disease causes relentless pain, neurological symptoms, debilitating fatigue, and cognitive problems. The number one cause of death in cases of Lyme disease is suicide. For a certainty, antibiotics are a valuable treatment right after one is initially exposed to Lyme disease. But unfortunately, the experience of many Lyme patients is taking antibiotics over years and still not getting well, or even getting worse. Medical research of chronic or stage 3 Lyme patients backs up this clinical reality, that antibiotics fail to improve the symptoms of late-stage Lyme disease or prevent it from returning. There are 4 key problems with antibiotic therapy. Number 1. Antibiotics generally only destroy the outer cell walls of mature Lyme bacteria, but up to 90% of all infections are not in the form affected by those antibiotics, but instead are in a cell wall deficient L form or in cyst form, hiding inside the cells. Number 2. There are many other Lyme co-infections that are unaffected by antibiotics since they are not bacteria. Number 3. All these dying infections congest the body's detox pathways, and antibiotics do nothing to assist this. They only make it worse. Number 4. Antibiotics can't restore normal healthy immune function. So, this leaves the question, how do late-stage Lyme patients get well? The answer has been around for a while, surprisingly. On December 28, 2002, a highly successful Lyme disease pilot study of 28 patients conducted by William Lee Cowden, MD, and several other clinicians and researchers proved definitively that natural medicine alone can be dramatically better than antibiotics for late-stage Lyme. Here is what happened. During the 10 weeks of this study, a control group of 14 patients were treated by a Lyme-literate medical doctor with antibiotics alone. These were matched for age, sex, blood type, and severity of illness to the natural medicine treatment group. During the study, this antibiotic group did not substantially improve. 3 reported improvements of less than 30%. 8 reported no improvements. 3 worsened. But do not despair. Of the patients under Dr. Cowden's care, there were exciting results. Initially, 1 patient left the study due to a health matter identified by Dr. Cowden that required surgery. But all 13 of the remaining patients reported improvements in all symptoms from 35% to 90%. Almost half became negative for Lyme disease by CDC criteria during that short time on natural medicine alone. Of the 13 Lyme patients on a holistic protocol using nutramedics and other nutraceuticals, here are the following improvements. Fatigue, 92.3% improved. Stomach pain, 100% improved. Joint pain, 87.5% improved. Memory, 88.9% improved. Muscle pain, 100% improved. Peripheral neuropathy, 100% improved. Most reported improved sleep as well. 0% worsened. Keep in mind, these are late-stage Lyme patients, so these results were truly amazing. Kinesiology and dark field microscopic blood examinations during this study period showed dramatic improvements, reductions in inflammatory markers, reduced visible spirochetes, fibrin, and parasitized red blood cells. One of the patients in that study, an 18-year-old woman that was fully disabled and unable to walk without a walker or her parents' assistance, had been frequently hospitalized with anaphylactic reactions, went on to recover and go to college and lead a normal life, free of Lyme disease. To be sure, these results were unprecedented, and it definitively established something that many of us in the holistic healthcare world already know, that for end-stage Lyme disease and most chronic illnesses, natural treatments are just better. But the question is, why do so many Lyme patients that are self-treating or working with holistic or Lyme-literate practitioners fail to heal, fail to get better, or sadly, even get worse? It is because many holistic Lyme disease recovery programs tend to leave out key components of recovery. As a fully recovered Lyme patient, a naturopathic doctor, and one of the original patients in that Lyme study those years ago, I have had the privilege to be mentored closely by Dr. Lee Cowden, MD, and the satisfaction to help other Lyme patients become success stories as well. I can tell you that many efforts at reversing chronic Lyme disease fail because they simply aren't comprehensive enough. They aren't synergistic enough. We are combining the best of the best in holistic clinical synergy to help those suffering with Lyme disease. In addition to doing a thorough job of reproducing the type of base protocol that resulted in healing in that original Lyme disease study, we also have the most unique combination of clinical therapies that can be found in Las Vegas. Having worked with Lyme disease as a naturopathic practitioner for many years, I can say with confidence that we are truly addressing Lyme disease at a holistic level that will be very hard to find anywhere else.
For more information, please call 702-551-3335 or visit our website jackmillernd.com.